Why don't doctors use liposuction to get rid of fat in morbidly obese patients? It's medically traumatizing to the body and doesn't address the underlying problem. Bariatric surgery is a possible tool some folks can use to lose weight and keep it off. Edit. Spelling fix. Barista surgery lel. Every time they do liposuction, a bunch of blood comes out with the fat, and your body will not react well to losing a lot of blood at one time. I remember reading they don't like to take out more than 35 pounds of fat at one time. So liposuction isn't a good option for dealing with obesity. Doctor now says all the time there are blood vessels running through the fat that have to be cauterized or they could bleed out. Jamming a lipo bar rapidly through all of them won't be good. Liposuction is pretty invasive for one thing. It's not permanent, and so it doesn't address the underlying causes. It also is not suitable for removing that volume of fat. Bariatric surgery not only restricts the volume of food consumed, in doing so, it also alters the entire neural hormonal feedback loops that drive obesity. The more medical history we gather about bariatric surgery, the better it stacks up against most other interventions. The surgery carries a risk of death if the patient is obese enough. They're usually encouraged to lose weight naturally first before attempting a surgery like lipo or lap band. You can't solve an eating disorder with a glorified vacuum. I had lipo as part of a revision surgery after breast reconstruction due to cancer, and let me tell you, it's not an easy surgery. Mine was a very small area and the bruising and pain are real. There's no way someone could have this all over their body only to gain it back without changed habits. In your body, whether you are fit or fat, you have fat cells. As you gain weight, the fat cells fill up, and as you lose weight, they empty out. A liposuction is different than weight loss in that it completely removes the cells out of the body. If you were to get a major liposuction like these people would need without correcting the underlying causes of the weight gain, namely your eating and exercise habits, then you will end up gaining weight in all sorts of weird places and end up shaped really weird, but most importantly, you'll gain more visceral fat, which surrounds your organs, which puts you at an even higher risk of death than when you started. If you don't treat the cause, they will just get fat again, and liposuction requires you to go under anesthesia, which is dangerous for obese. It is always very painful and traumatizing and requires time to heal. And even the healing process is dangerous and isn't worth the risk if you are just going to regain all the fat back. The stomach bands at least affect your appetite and does help the underlying problem, but you can stretch your stomach out again, so you still generally have to show you've been changing your habits before they are willing to do this. At least that's what doctor now says, and that's where my knowledge comes from. Lol. Bariatric surgeries are associated with lifestyle change. The fat loss from liposuction can be negated in a few weeks or months. Generally, liposuction can remove less than 10 pounds of weight from an individual, and morbidly obese patients need to lose a lot more than that. Gastric bypass can help them lose way more and keep it off. Because liposuction only treats subcutaneous fat, the fat that is really affecting people's health is the visceral fat deeper within the body. The larger someone is, the riskier surgery is. General anesthesia can have more side effects, and surgeons tend to want to avoid surgery on larger people. There is a limited amount of fat that can be removed using liposuction before it becomes dangerous. After the surgery, they don't close the wounds. They stay open to continue draining out fluid. The recovery is incredibly painful, and they do not make compression garments large enough for the size that these people would go down to. Aftercare would also be very difficult. Also, these people are generally huge due to poor diet and no exercise. Removing 7 kilograms of fat surgically will not do much for them, because fat has to go somewhere. I don't know if this is still a problem, but in the 90s 2000s with liposuction, one of the main problems, so I heard, and saw in a couple of cases, is they would get the fat cells sucked out, and the body was like, fat doesn't go there? Okay, it goes here. And then they would get fat in really odd places, because there's still fat cells that weren't sucked out there, and they go into overdrive. I saw a couple women like that before. One was skinny except for her arms, neck, and head. It was really obvious she had something done and had just kept eating. So even if they could get rid of all the fat easy with lipo, they still need to stop it from coming back, hence the bariatric. Also, surface fat is technically better than fat around the organs, which is also where more of it would end up with lipo. So without fixing eating habits and whatnot, it's worse in the long run. https://silhouetteplasticsurgery.com/blog/game-weight-after-liposuction/ https://silhouetteplasticsurgery.com/blog/game-weight-after-liposuction/ https://www.nbcnews.com/id/WBNA4285240 https://www.nbcnews.com/id/WBNA4285240. There is a limit to how much fat doctors are recommended to remove from the body via liposuction in one go. I believe it is 5 liters. The weight loss would likely be negligible relative to their total body weight. A few reasons. 1. You can't remove that much fat to take a morbidly obese person to even obese with just liposuction. The amount of time it would take in order to remove that much fat would kill someone. Another reason is that the amount of anesthetic it would take for a person of that size would make it incredibly dangerous and very likely they would die. Anesthesia is a very delicate balance and is very weight dependent. It would also make it very difficult for the anesthesiologist to do their job safely since there are so many complicating factors for someone that obese. They have to breathe for you. So many complications could arise that it's not common practice to do elective surgeries for morbidly obese people, because the risk outweighs any benefit necessity. Liposuction is for small amounts of fat, and rarely results in a large weight loss, 10 pounds or less. It's designed more for taking fat from stubborn areas, or distribution of fat, as opposed to weight loss. Great fun being a nurse when a bariatric surg patient returns for plastics to fine-tune their healthier body a couple years later. It's a privilege to help out. The body is always going to attempt to maintain homeostasis. This applies to the internal environment, keeping temperature consistent, hormones and various signaling agents all acting and reacting to maintain a balance. Now 600 pounds is well outside healthy, but most systems aren't trying to maintain some ideal human health condition, just feedback loops of various kinds. Metabolic set points tend to have a given body fight to maintain a given weight. Regardless of overall health, it can't beat physics or CICO, but any leeway tends to be applied to whatever the set point is. It can be changed, but it's considerably more complicated than simple weight loss. Now surgical intervention can remove fat cells. The remaining cells will try to compensate and possibly expand to roughly the same appearance, given time. Honestly, fat is a dynamic tissue that does much more than act as a storage sink. Just lopping off a portion of it is probably not usually an ideal solution because it doesn't fix the issue. The issues are the underlying eating habits, the habit of not having as much, and the mindset of the patient. Of course, illness and injuries aside, these are the most common reasons why people gain weight. Liposuction won't fix those issues and give it a couple years and we'll be back to square one. Doesn't address the underlying problems of lifestyle needed to maintain weight loss. There's a limit to how much they can suck safely out in one go. Bariatric surgery often has requirements to qualify, like seeing a dietitian, fitness coach, losing so many pounds beforehand to make sure the underlying problems are addressed. Lipo is for small areas of fat on otherwise normal-sized people. A person who weighs 600 pounds has around 400 to 500 pounds of fat. You remove it all at once, you'll probably die.